Hi, I'm Ong Yee Seng from class for Yakin. Today, I will present to you the traditional methods of treatment for health issues related to the nervous system. First of all, I would like to express my deepest gratitude to my biology teacher, who is none other than Pon Asara herself, for providing valuable guidance and an opportunity to carry out this project. I'm also very thankful to my friends, especially Suvarna Ruben, Jeremy Fu, and Tuan Muhammad Wasim for their help and encouragement throughout this period of time when I was carrying out this project. Finally, I would like to thank my family, whom I dear most, for giving me support towards the very end. Once more, thank you to everyone who has aided me in completing this project. The nervous system, essentially the body's electrical wiring, is a complex collection of nerves and specialized cells known as neurons that transmit signals between different parts of the body. We should be thankful for having a central nervous system that functions well. However, the central nervous system can become damaged and stop functioning efficiently. The symptoms of a damaged nervous system depend on which area of the nervous system is involved. Nervous system problems may occur slowly and cause a gradual loss of function, or they may occur suddenly and cause life-threatening problems. Treatments for such health issues may potentially cost a fortune. Thus, many people opt for traditional methods which has been practiced for hundreds, if not thousands of years. This project has three main objectives. First and foremost, the objective of this project is to present information on traditional methods clearly and rationally. Besides that, this project is to implement the correct procedures throughout the process of collecting, analyzing, and presenting data. Last but not least, this project is to provide solutions that are capable of solving issues revolving around traditional methods. So what is acupuncture? Acupuncture is a technique that involves inserting very thin needles into the skin at precise points on the body to clear energy channels. The spots of insertion are picked based on a complex network of lines of energy, termed meridians. Here are some clinical meta-analysis and research on the effectiveness of acupuncture on various central nervous system diseases. First and foremost, a systematic review and meta-analysis that evaluates the use of acupuncture for relief of Parkinson's disease symptoms has found that acupuncture has significant positive effects. However, in another study, acupuncture couldn't cure amyotrophic lateral sclerosis but can be offered with confidence to reduce the symptoms associated with all forms of motor neuron diseases. In addition, 95% of cases from a clinical trial that studies on the effects of acupuncture on gait of patients with multiple sclerosis has shown an improvement, compared with 45% when sham acupuncture was done. What are the risks associated with acupuncture, you might ask? Observational studies have shown that roughly 10% of patients experience mild and transient adverse effects after acupuncture. Serious complications, including deaths, have been noted with some regularity. As of 2010, 90 deaths after acupuncture have been anecdotally documented in medical literature. The fatalities are usually due to an acupuncture needle penetrating a vital organ. In conclusion, death after acupuncture may be rare, but they do occur. The best way to minimize the risk is to make sure that all acupuncturists are well trained, not just in acupuncture technique but also in recognizing serious adverse events and initiating life-saving measures. Now that I'm done talking about acupuncture, I will now present to you chiropractic treatments. The theory behind chiropractic is that proper alignment of the body's musculoskeletal structure, particularly the spine, other joints, and soft tissues, will enable the body to heal itself without surgery or medication. Manipulation is used to restore mobility to joints restricted by a tissue injury caused by a traumatic event. Back and neck pain are the domains of chiropractors, but many treat conditions other than musculoskeletal problems. However, chiropractic spinal manipulation has not been shown to be effective for any medical condition with the possible exception of back pain. From the year 1982 to 2002, the proportion of the population using chiropractic services has doubled in North America. With no doubt, the amount of people that use chiropractic services will continue to increase as the population grows. However, are chiropractic treatments worth the risk in order to restore health? The meta-analysis in the next slide shall reveal the answers. Here I shall elaborate on the risks associated with chiropractic treatments. In California from 1998 to 2002, a comparison has shown that chiropractors are 98% more likely to receive disciplinary action than doctors. Forgery was also reported to be 895% more likely to happen from chiropractors than doctors. Patients are also 339% more likely to face sexual harassments from chiropractors than doctors. 700 serious complications and about 50 deaths are reported in a systematic review up to November 2001. A 2008 systematic review found 14 cases of adverse effects of spinal manipulation in children, 10 of which involved serious complications such as subarachnoidal hemorrhage or paraplegia. This systematic review of chiropractic spinal manipulation has collectively failed to demonstrate that spinal manipulation is effective, with the only possible exception of back pain. For this condition, manipulation may only be as effective as standard therapy or just simply ineffective. Moving on to the final traditional method to be discussed today, which is reflexology. Reflexology is described as a system of massage used to relieve tension and treat illness, based on the theory that there are reflex points on the feet, hands, and head linked to certain organs and body systems. Due to its soothing massage and non-drug complementary nature, reflexology is widely accepted by the general public. Reflexology practitioners have advocated that reflexology is effective for general well-being maintenance and treatment of chronic diseases such as strokes, musculoskeletal disorders, and stress. Yet, numerous systematic reviews confirm that strong evidence of positive effects of reflexology post-intervention are lacking, despite plenty reported small-scale trial and anecdotal evidence of reflexology for some common ailments. However, the risk of health complications from reflexology is rarely documented, as it is unlikely to cause any form of injury, not to even mention fatality. Although its efficacy has yet to be clinically proven, it can be considered as a complementary treatment for mild health issues such as the aching of the limbs. Based on a clinical trial that studies the efficacy of reflexology for symptom relief in a more disabled multiple sclerosis population, no statistically significant differences were observed between the two groups, which are true reflexology group and sham reflexology group. However, both groups demonstrated small improvements. In conclusion, the results do not support the use of reflexology for symptom relief in a more disabled multiple sclerosis population and are strongly suggestive of a placebo response. At this stage, I would like to conclude my research by pointing out a few problems revolving around traditional methods and ways to work around it. As of now, the efficacy of traditional methods such as acupuncture is still disputed. Even if it is considered as an unavailing treatment, I think it still helps patients in facing life-changing diseases, as many physicians consider placebos to be really effective or even safer than the use of opioids in alleviating the symptoms. By far, I came to the conclusion that acupuncture is the most effective traditional method among other traditional methods studied in this research. These comments from the subreddit R Medicine and R Medical School matches my opinion on traditional methods. In general, patients should be receiving treatments in the following order, moving to the next if prior fails. First of all, the most currently recommended evidence-based practice. Second, alternative but approved therapies. Third, experimental therapy in approved phase 3 clinical trials. 4. Prospective experimental therapy in phase 2 clinical trials. Fifth, complementary/alternative medicine therapies with benefits shown to be statistically placebo equivalent, but helpful for some. The Reddit user Happy-Go-Lucky, who is a medical degree holder, states that sometimes something that was formerly considered alternative medicine is proven to work, and is incorporated in what we consider medicine now. If you look at the history of medicine, you'll find that many drug ingredients or therapies were taken from sources that were not considered medicine at the time. However, what is now considered alternative medicine has either not been proven to work or been proven not to work. Back to my concluding statement, opting for traditional methods should be acceptable under the circumstance that patients are not subject to ludicrous expectations. It is important to have it done by certified practitioners to lower the risk of casualties that may happen during the process. Consulting a physician prior to making an appointment is crucial in protecting oneself from further health complications. That's all from my presentation on traditional methods of treatment for health issues related to the nervous system. I sincerely apologize if the quality of this presentation is not up to par. Thank you for listening.